And finally, on the word confidence, keep an air of confidence about the process. Confidence in the treatment plan presentation means you know that your team can deliver, and you know that the patient will benefit. It's simple. And plus, patients sense confidence. You appear more capable when you appear confident. They'll respect you more, and this feeds your confidence. And when the entire team acts confident, office morale is up, self-esteem soar, and patients receive superior treatment as a result. Once you've reached this point of presenting a treatment proposal, the patient shouldn't have any wonders of need, especially if their examination personally involved them in a co-discovery manner. Properly letting them participate in the diagnostic process, especially when you use an intraoral camera, adequately demonstrates their dental weaknesses. But remember, the camera only acts as a second opinion. It's what's said to them and how that helps them make up their mind to restore health to their mouth. You must know the case thoroughly. It must be laid out in writing. These only help build the belief that you can properly present the treatment. You know, when the first runner ran a mile under 4 minutes, many other enthusiastic runners quickly followed. As you successfully share treatment plans and patients accept them, you'll become a believer. But why wait? Patients are accepting comprehensive dentistry all across America every day. Come to know that patients consent to comprehensive dentistry. Become enthusiastic about helping to deliver it. Promote a winning environment. It'll make patients feel more important. And most important, try to have some fun. People relax and feel more comfortable when things aren't so serious all the time. This confidence we talked about, it builds through knowledge. These films are doing just that, building your confidence. But they're building your patient's confidence in you as well, and even your doctors. They're seeing the change. Don't stop finding out how others have found success. Copy them. And finally, when it comes down to getting a yes or a no from the patient, what's there to lose? If your doctor and the office provide dentistry to be proud of, could you really risk them going somewhere else for their own sake? The fear in coming to the point of asking for a commitment is a fear of rejection of ourselves. But it's really not this at all. Patients reject treatment. If they were going to reject you, they'd not be here in the first place. Presenting a treatment and simply inviting the patient to get back with you when they've decided, this doesn't help anybody. You have to ask for a commitment. Thankfully, it doesn't have to be as crass as it sounds. Listen to this question. If money were no object, Miss Smith, would you want to pursue treatment? Now, there's so much to learn from this statement. The patient's response is going to identify their position, whether they're excited, hesitant, absolutely disinterested. You've done all you can, and now it's their turn. Patients who remain uncommitted, in spite of their interest and acceptance, shouldn't be sent away before inviting them back for a second no-cost consultation. They're probably sincerely interested in receiving care, but something's stopping them from consenting. They may merely want to think about it a bit longer. There's little danger in losing them if they know that they're not being rushed. So invite them in this way. Miss Smith, I can certainly understand your need to check on a few things. Why don't we schedule a second no-cost consultation next week, and then you can make a final decision about your treatment. If they turn this down, they probably aren't motivated, and if they accept it, they probably have some sincerity. And remember, it may take several of these consultations. If it's a large case, they'll be worth it. If the patient says yes to the money is no object question, you've gotten their acceptance of the treatment, but not fully. The financial element is still present. But until they've accepted the treatment, there's really no reason to move on to the financial aspect. As I said, our society's finances are based on monthly payments. Few people can pay for things in full. Monthly payments are why people can buy new cars and homes, and comprehensive dental treatments as well. A $20,000 or $30,000 car is much more attractive at $400 a month than, say, spending $25,000 cash at one time. After the case has been accepted and the fee has been presented, all financial options should be presented. This is best left to the office's financial consultant, somebody skilled in answering questions about money. Naturally, this consultant must also be as strong in treatment presentation skills. Otherwise, everything you've helped gain could be lost with a few short words. The financial consultant's job is to simply help the patient select just one of the financial options available. As soon as the patient has accepted the treatment, bring in the consultant, who's already familiar with the case at hand. As a transition, to instill the value and the importance in the financial consultant, say something like this: Ms. Smith, Ellen will explain our financial options to you. She is always able to work out financial arrangements that allow our patients to pursue treatment. Feel free to ask her any question at all. She'll go out of her way to help you. A well-trained financial consultant will be able to take it from there. If the patient suggests working with insurance benefits, keep this in mind and remind them about it over and over again. The insurance policy is between them and the insurance company. It is never ever used to decide ideal treatment. Before any treatment is started, the patient should know what's needed, why it's needed, what are the alternatives, and the expense. And based on all of this, the patient consents and accepts your offer of treatment. This is called informed consent. However, along the way, patients will share objections. It's rare for someone to blatantly accept your treatment offer without some. In fact, it's almost unheard of. Objections indicate the patient's concerns. They're telling you what they need to hear to accept the care. To handle the objections, simply remember these 4 things. First, remember to relax. Don't become defensive. Don't become argumentative. Share responses that help build trust. Next, remind yourself this is your chance to clarify their concern. Validate it. Say something like this: Boy, you're really going into this thoroughly. That'll help you avoid making any mistakes. And then use knowledge to answer. By role-playing with other staff members, you can develop truthful responses to the offered objections. Referring to earlier patients who shared similar concerns also helps. And finally, stay positive and enthusiastic. If you believe that what you're offering will truly help the patient, they'll come to believe it too eventually. Remember, treatment plan presentations go well beyond this formal process we're describing. Simple restorative needs like crowns to protect teeth from breaking, cosmetic dentistry to promote self-esteem and even lifestyle like for some sales professionals, and even complex dentistry to restore chewing and overall health to a diabetic. These may all be suggested to the patient at any time, given the right opportunity. So always be ready for their questions. Their questions indicate interest. And after the final appointment, when the long-awaited dentistry has been delivered and the patient now sees beautiful results that he had only imagined before, ask the patient this question: Are you fully satisfied with the results? And if they are, ask them these key words: Would you do me a favor? Would you be kind enough to send me a letter about your dental experience and how you feel about the results? Most patients will follow through since it's a favor. Ask for their permission to include it in a book to show patients. Later, by reading about other people's feelings, patients who see it may be less anxious about dental care. By being prepared, knowledgeable of the procedures, comfortable in your doctor's abilities, and a believer in the benefits that it affords the patient, the dentistry that you sell becomes a 24-hour-a-day, 7-day-a-week, 52-week-a-year lifetime service for the patient. And when you practice like this, the patient will never forget you and the doctor, and she'll enjoy the benefits for life.